if you could sum it up, primary care is most of the care for most of the people most of the time. Most people in our society don't need a specialist. They don't need a cardiologist or an oncologist. They don't need an ologist, but everyone needs primary care.
Hello, everyone. That was Dr. Deb Richter encapsulating primary care. We'll hear more from her later. I'm Mike Palmer. Welcome to this webinar on the campaign to pass H433 into law, beginning with a drive to get a supporting resolution on town meeting agendas. So I'll be saying a couple of words of welcome and what we're doing in the petition to put the H433 resolution on the town meeting agendas. The first item on the agenda for this evening, after I get through saying hi, is what H433 does, which Ellen Oxfeld is going to talk about. And then after that, we will be talking about why we need this bill with Dr. Richter, who is, along with Ellen, one of the longstanding advocates for universal health care in Vermont, going back to the time when Dr. Richter came to Vermont. And then we will go on to Ethan Park, who has been instrumental in getting H433 on the agenda in the legislature. And he's going to say a few words about how we fund the program or how the bill would fund the program. And I'll say a couple of things about Vermont petition law and signature gathering. And then we'll have the rest of the time for questions. And then we'll close with what next steps are. So I think that pretty well says it. And I hope most of the people who are joining us are already here. A lot of people have signed up with the idea of getting the recording afterwards. So we have about 20 people with us now, and there may be a few who join us after a bit. So under current law, Vermont must ensure universal access to high quality, medically necessary health care for all Vermonters. And the systemic barriers, such as cost, must not prevent people from accessing necessary health care. That's the current law. The reality, as we know, is not that. And so we have a process that we need to go through to get to that. And H433, if you've looked at the bill or read summaries of it, you know that it's designed to start with primary care, universal primary care, and over a 10-year period, develop into universal health care. So the goals of this campaign that all of us are working on right now is the first goal is to get signed petitions enough in each town to get the resolution supporting or calling on the legislature to act on H433 on town meeting agendas. The next goal after we get it on the agenda is get the committee to act on it, get the speaker to okay that, and the chair to schedule testimony. And the next goal after that is to pass the bill in both houses and get the governor to sign it. So those are the three main goals of the campaign. So I'm going to stop and turn it over to Ellen, who's going to talk about what H433 does. Ellen?
Okay, I'll be fast because I have two of my colleagues here, Deb Richter and Ethan Park, who can give a lot of detail as well. But just to make a very long story short, H433 would phase in universal health care for all Vermonters, taking out the middleman, making healthcare a publicly funded public good. But since we are aware that this is a big lift and we were unable to get the political mobilization and get the whole thing across the finish line back in 2011 when Governor Shumlin signed a single payer bill, this would be a phase-in, and it would start by making primary care, mental health, and substance use treatment a universal publicly financed public good. So you would phase in and begin with primary care. Why phase in? Why begin with primary care? First of all, primary care is under 6% of our current total spending on health care. Secondly, it's very important. We know that right now, over 42% of Vermonters are underinsured. If you talk to any primary care doc, they will tell you people do not Insured people even do not come into their office because out of pockets are so high. So people avoid going to the primary care doctor or provider, and then they only end up going in much later when often they have a horribly, sometimes even fatal condition which has been untreated. So primary care is the first line of defense. It's the line of defense that raises the population's degree of health the most. And also, once you get that going, you can add other sectors. The beauty of this, though, is everybody would be in, nobody would be out, no means testing. Once you get to means testing, you're keeping some people out. That gets administratively complex, and that's not a good thing. I also want to say very quickly, and then I'll hand it off to the others, the idea of phasing in universal care by bringing in one sector and then adding others is an old idea. This province in Canada to have universal publicly financed healthcare. What they did is they first started with universal hospital care, and then they added primary care. So all that H43 does is reverse that and start with universal primary care. And then once you get that going, you can add other sectors. But the beauty is, and this is something to remember, the easiest way to remember, everybody in, nobody out. Take out the insurance company middleman that takes up 1/3 of our costs right now. A waste. Insurance companies provide no real health care. So that's it, because I know we don't have a lot of time, but I hope that that's, a little bit of what H433 would do. And by the way, I'll just say really quickly, within H433, if it were to pass, they ask for, and I know Ethan will speak more about this, they'll ask for a financing plan for this and an operational plan. So, obviously sometimes these are complex, but they can be done. But the bill would include that, and it sets up a commission that would create a fair financing plan for this. And I would say minimally, we have to get that financing plan and operational plan passed this year, because there are people who are interested in doing this, and having that information will help them to get this over the obstacles. So I'll stop right there. Yes. Yes.
Yeah,
I just to
thanks.
answer something Mark Gibson just said in the chat, people
Yeah.
say it's too expensive. We are spending more now because $1 out of $3 goes to administrative costs in our current system. So
Yeah.
we're wasting it. We spend 6.5 billion now or more really in Vermont on healthcare. So just think of that. Think about like 2 billion of everything we spend now is just wasted. Obviously, this bill phases it in, so it would start with primary care, which is probably we could do for around 200 million, is what they said in a study in 2015. Even if it was 300 million now, that's a small percent of what we spend on total healthcare spending. So yeah, I'll leave it there.
Okay.
You're waiting. Let me add one more thing. I know
Yeah.
you are going to speak to the importance of this town meeting petition, and it is very important. Before we end today, I would also like to say that town meeting is in March, and that would be great if we can get some towns to vote for this. But before March, hopefully people in this group can stay in touch, and going up to the State House, even if you find, we are all busy, but you find a date that you can get up there, maybe in a week or maybe in 2 weeks or 3 weeks, and you sit in on House Health. And when they take a break, you talk to them and say, you want this bill passed through their committee. You would not believe how important that is, especially if it's a diverse set of characters. So, if it's like one or two people, the same people, they're not very impressed. But if each time there's like one or two people sitting in on their committee, and it's like, oh, I don't know this person. It's not the typical nudges that I know. Oh, people are really interested. So I would urge people, and we can, communicate through Mike and by email, etc. But I would urge people to, probably not this coming week because it's just the beginning of the session with the governor's address and all that. But starting next week, if you look at your schedule or you want to carpool with some people, pick a date, say, I'm going to go up to the legislature that date. I'm going to sit in on House Health. As I said, you can't speak while they're meeting, but when they take a break, you buttonhole them and say, I want this bill passed. Take this off the wall of your committee. That is very important. So,
Thanks, Ellen. I'm going to go on to the next item on the agenda, which I hope I can do. Here we go. Why we need H433. And Dr. Richter, Deb, you've joined us.
I
Can
have.
you speak to that issue?
Yes, I can. Well, first of all, I mean, I think it's most people understand that the primary care doctor, primary care practitioner is the first line of care. That's the first person you should be calling and should have available should you have a concern. And, that it's really, if you could sum it up, primary care is most of the care for most of the people most of the time. Most people in our society don't need a specialist. They don't need a cardiologist or an oncologist. They don't need an ologist, but everyone needs primary care. And again, that's also why I would say this has got to be politically attractive for legislators because every single constituent would have coverage for primary care. And it's also the smallest in terms of investment. It's the smallest sector in terms of how much we spend on it and how much we need to spend on it, and the biggest return on investment. Because when everyone does have access to primary care, we know that as a population, the population is healthier. That's been shown in numerous studies in this country and in around the world, in the industrialized world, where primary care is available. It saves money, it saves lives, increases life expectancy, lowers infant mortality, all the quality indicators improve when people have access to primary care. It makes sense. So instead of sitting and going, gee, I wonder if I should do anything about this cough or the mole on my arm or a fever, instead of just wondering and then maybe eventually going to the emergency room where it's more expensive, you have someone to call. And a lot of people use the excuse, well, we can't do it because we already don't have enough primary care. A universal primary care bill would be incredibly attractive to doctors and residents ready to practice medicine and come. And we've actually had a study done years ago when we were looking at single payer that 200 doctors had said that they would move to Vermont if we had single payer, and 60 of them were primary care. So we know it would be attractive. It would be certainly a situation where fewer doctors would retire early, which is what's happening now. And it would increase actually the productivity. Doctors could be more efficient and with the practice. So there's a lot of reasons why this is an attractive bill for us to push for. And that's it.
Thank you, Deb. Anybody have any questions right now? We're going to have a lot of time for questions afterwards, but if anybody has an immediate question, please ask it now. If not, then let's go on to how we fund the program with Ethan Park. Ethan?
Yes, thank you, Mike, and hello, everybody. H433 has a section that has a very cursory approach to the financing question. It creates a commission to look at financing in more depth and also to develop the operational plan, as I think Ellen mentioned. H433 does say that a payroll tax, a self-employment tax, and an income tax surcharge may be considered by this commission, but it does not mandate that those are the taxes that would be used to finance the program. When we talk about the financing, you need to remember what we're financing is the out-of-pockets and the insurance premiums, commercial insurance premiums that Vermonters are currently paying for primary care. So in other words, Medicaid, which is partially federal funds and partially state funds, those monies would stay in place. Medicare, the same thing, that's federal money. So what we would need to finance is all those gaps that Medicare does not cover and the out-of-pockets and the premiums that people are paying currently. And the last time we really had a pretty good estimate of what that number would be was back in 2015. So more than 10 years ago. We need to update that so that we know what needs to be raised in new revenue. It's a job that could be done probably through the Joint Fiscal Office of the legislature, and they might hire some professionals to help them with that kind of a study. Really, with a part-time citizen legislature, it was infeasible to have a very detailed financing plan outlined in this bill. I think a decision was made by the bill sponsor to go ahead and try to pass this as a first phase and create the commission that would then come back and develop the financing plan. So that's where we are.
Okay, thanks, Ethan. Does anybody have? I suspect people have questions about the funding of this, and this is one of the things that in gathering petitions or signatures on petitions may come up with some frequency, how you're going to pay for it. In fact, I'm sure it will. And if anybody has any specific questions on that, Ellen, you want
Yes,
to say
I
something?
wanted to inject one note that I've been standing outside the Middlebury Food Co-op for a few days with the petition, and it's like people can't get the pen fast enough. They are not interested right now in the wonky details that we are interested in as longtime advocates. They are so concerned about healthcare that when I say they say, what will the petition do? I said, well, it would allow the town of Middlebury to put a resolution on our ballot in March that will ask our General Assembly to pass a bill that will phase in universal health care. And then I say, starting with primary care. But before I even finish the sentence, they often say, give me the pen. Because people are hurting a lot on healthcare now. So I do want to say, while it's important for us to ask these questions. And we do need to know them because legislators, when we go up there, they ask a lot of specifics. But I do want to say I have been very surprised. I don't know, maybe because it's cold, they want to sign fast. That's the only other explanation. But I just want to inject that. It has been very different this year than other years. People are really feeling the pain and they really want our legislature to do something. One or two people will say, I think it can only get fixed in DC, but most people aren't really looking to DC for obvious reasons.
I wanted to add one thing that I remembered also, and that is that a goal of any financing plan would be to have people pay less in new taxes than they are now paying in insurance premiums and out of pockets. And this is entirely feasible because we would be achieving so many savings administratively. And with a carefully worked out financing plan, people would come out ahead.
Okay, Andrew, would you take yourself off mute and ask or say what you want to say?
Yes, absolutely. My question is, do we have a number right now for what the average Vermonter is paying in healthcare? When we talk about, how much is this going to cost? Do we have a number of what it's costing us now?
We have the numbers from 2015, which was about
Yeah.
200 million
That-
a year
Right.
that would need to be raised for universal primary care. With inflation, it's probably around 300 million now.
So 10 years ago, 200 million.
Yeah.
Okay. Well, we could do a quick and dirty look at that, plus all kinds of other silly things going on. But thank you. I think that would be a useful thing as we were telling people, oh, well, you're going to pay more in taxes, but it's going to be less than you're paying here. We need to get a rough idea what we're paying in taxes. What's the total amount for the whole state? So that's good. Thank you.
Yeah.
Alice, you had a comment?
Yeah, I have a question actually. One of the first things I was asked today when I brought the petition to the gym is, are there any states that have done anything like this?
No,
Okay.
there's not any state in particular that's done this, but there have been some experiments that are sort of on a smaller basis. One actually was the equivalent of a universal hospital bill in Rochester, New York. That was highly successful in lowering insurance premiums and actually making hospital care universal. It was the closest thing to a single payer, and this was back in the late 80s, early 90s. And the General Accounting Office actually did a study on it and showed that insurance premiums went down 45% below the state level and 33% below the national average. So we've had it done in that way. The other experiment that was sort of done was in Montana back when I guess it was Governor Schweitzer who wanted to actually have a universal primary care, but he was not able to get the waivers for it. And so he decided to use just state employees. So they did a universal primary care for just state employees and saved 1.5 million the first year, which is when you consider what is, again, a smaller state in terms of population, saving 1.5 million just the first year in what they would have spent on primary care. Plus people, they were able to get to diseases earlier because they actually, addressed them earlier. So people did better and were healthier as a result. I don't know if that program is still in existence, but it was just for state employees. So there weren't any states that have done it at the state level for every single resident in the state. But there have been minor experiments in other places.
There are three hands up, so I won't take long, but my understanding is that for universal primary care, Vermont would not need a waiver of any federal law under ERISA. And I've looked into that, so I think we don't have that hurdle to deal with. I don't know who was first, but I'm going to go with Beth Kindle and then Jane.
Yeah, I just have a quick question because I've been asked as I'm starting to work on this petition also, how it would affect Medicare or folks on Medicare. And someone indicated earlier that it wouldn't, but is that blanket? It just wouldn't? Hey, Deb, what do you have to say?
Ellen, do you want to answer that?
Yeah.
You had your hand up. Go ahead.
Okay.
Oh, Ellen,
Yeah.
sorry.
Just to answer that, if you don't get a federal waiver, then any universal program we have here will function as what we call a wraparound. Okay. So, like you have Medicare. Let's say we did an entire single payer system. We did primary care and then we added hospital care and the whole 9 yards. Then it would essentially wrap around what Medicare doesn't pay. You know, we're all aware that Medicare, when you have Medicare, you need supplementals, et cetera. So, you know, if we, at some point, if we ever had an entire single payer system, it would be a wraparound, but it would be the same for primary care. So, you know, people would have their Medicare and that would wrap around whatever Medicare didn't cover.
Right.
You look a little confused, so I'm wondering if
Well,
that's
so
clear.
currently,
No one would be getting less than they're getting on Medicare. They would be
Right.
getting more. That's basically the upshot of it.
And it would, so given that Medicare
Same for
doesn't-
Medicaid, it would be a wraparound.
Yeah, given that it doesn't go through insurance companies, it doesn't save premium, it doesn't save money there.
Yes, it does.
Yes, it
because-
does include insurance. So you wouldn't need private insurance any longer for primary
Yes.
care. So your premium would actually be approximately 5% less because it represents a much smaller percentage
Mm.
of what the insurance companies pay out. But you
Okay.
would no longer need any private insurance for primary care.
Okay, thank you.
They're not allowed, and I would just add, the insurance companies are not allowed to charge you for a service for which they will not pay out. So
Got it.
if primary care becomes a public good, like our public roads and
Right.
all that, then insurance companies aren't paying for that anymore.
Got it.
And so they can't charge you for that. And similarly, again, if it phase in and the next thing is, hospitals, et
Yeah.
cetera, the same would follow. I do want to say that there is precedence for this. Again, not in the United States, although Deb has given some, but Saskatchewan did exactly this when they started their single payer. They started with universal hospital care, then they added primary care. But it was the same principle of phasing in, but making a service universal for everyone. Yeah, just
Thank you.
wanted to add that. Yeah.
Okay, Jane, you had a comment?
Yeah, I guess I'm stuck on the financing. While I've had people want to sign quickly, there are several people who say, but how's it going to be financed? Because they know that was the stumbling block. And I was taken aback by the suggestions in the bill of regressive taxes. So I was just wondering why we couldn't have put in, if we were going to put in suggestions for financing, why progressive taxation couldn't have been put in. Keep on harping on tax on the wealthy. The second thing is, Deb, you mentioned the Saskatchewan, how it was unrolled there. I've had people tell me that it's different because there was no insurance industry in Canada at the time. So that made it a little bit of a different situation, but I'm mostly concerned with the financing.
Right. I think the person to address Saskatchewan would be Ethan, who just wrote a book about it. Ethan?
Yeah, actually, there was an insurance industry in Saskatchewan. The insurance companies were controlled by the medical society for the province. They had their own private insurance plans that you could sign up for if you could afford them. And the reason why the doctors went on strike in 1962, when the rollout of universal medical care was happening, was that they didn't want to lose those private insurance companies, which were quite lucrative and were controlled by the medical society. So there definitely was that hurdle to overcome in Saskatchewan of private insurance. And it resulted in a very contentious 23-day doctor strike which nearly derailed the program.
It
But in
should be
the
known
end,
that the mortality rate went down during that 23-day strike
well,
because there weren't any unnecessary surgeries done.
right.
Yeah. So
And Saskatchewan did universal hospital care in 1947. And
Wow.
they did medical care, not exclusively primary care, but all medical care, specialty care, and primary care in 1962. And between 1947 and 1962, the federal government in Canada was goaded to implement universal hospital care, which they did by providing grants to all the provinces to copy Saskatchewan's plan. And the same thing happened after 1962. The federal parliament then was shamed basically into offering a program of funding for the provinces to offer universal medical care, also modeled after Saskatchewan, which was a single payer program. So,
And maybe Ethan, just you might want to address the financing issue too, the
financing, well, it's interesting. In Saskatchewan, when they did medical care in 1962, the financing was not particularly progressive. They raised the personal and corporate income tax by 22%. They also raised the sales tax from 3 to 5%, and they imposed a head tax of $12 per person or $24 per family, which eventually was discontinued entirely. So they were,
I'm sorry, go ahead.
as far as, more progressive taxes or wealth taxes, I think anything is on the table as far as H433 is concerned. But I do think it probably would have been a mistake to specify in H433 what those taxes would be. I think we need to get that bill off the wall and, establish that commission and lobby that commission like crazy for the taxes that we think are most fair. And I think that's kind of what happened in Saskatchewan as well, where the financing kind of was implemented after the fact a little bit. In other words, they concentrated on the concept, the principle of universal care, and then they figured out, okay, how are we going to pay for it? How are we going to finance it?
So let me just pick up on that and add a footnote to Jane's question. What we are doing this evening and with this campaign is democracy. We're actually doing what democracy is by doing what we're doing, this petition and so forth. And Vermont is a special state that has this law that I'll cover very briefly in just a minute that allows us to do this. We also can participate in the legislative process, as Ellen said, by going over there and buttonholing legislators and telling them we want this bill acted on and showing up at the committee and hearing meetings to testify and to say things like we should have a progressive funding mechanism so that this does not fall on the backs of the poorest among us, but on those with the ability to pay. So that's something we can do in this campaign and should. There's a couple of questions in the queue, so to speak. I think Mark Gibson had his hand up, and then Andrew Petto has his hand up as well. Mark?
Yeah, when I went up to the State House with Ellen one time to lobby for healthcare, I sat in on a House Health Committee, and I approached Lori, and I forget the head of the health, and I forget her last name, and I said, asked her about universal healthcare, see where she was. And there's a variant on all the questions we've already heard, but she said the reason we can't do universal healthcare is there's a huge amount of transition costs, and I don't know anything about what these transition costs are, and we don't have the money to pay for those big transition costs to make the transition from the current system to the other system.
Well, I would ask them why they had enough money. Yeah, why they would have enough money to implement this ridiculous accountable care organization. You want to talk about transition costs and administrative costs. It's just another excuse. And they'll say, we can't do it at the state level. It has to be done at the federal level. We don't have enough doctors, so how can we possibly do it? We can't raise taxes. There's all kinds of excuses, and that's just an additional one. There's no reason why they can't do this. If anything, it simplifies administration. There's no doubt there are some transition and there are some glitches. There are some things that if you do something at the state level, that if you do it at the state level versus federal, There are some, border crossing kind of issues and whatever, but it's not a reason not to do it. Just another.
Not only that, we have an infrastructure already in place, Mark, with Dr. Dinosaur that gives us a leg up on that because we have people who are already employed to do administrative work in that sector. The difference is it will be actually easier, I think, to do universal primary care because Dr. Dinosaur is means tested. This won't be. So there won't be anybody trying to check on whether you're eligible or not. If you're a Vermont resident, you're eligible, period. Okay, so Andrew, you had a question?
Yes, I have two. Actually, Mark answered one of them for us, which is, why is this thing being held up? What's stopping it? And the second question is really for Ethan, that when we were living and working in Alberta, one of the things that they had there, which I believe was a federal program, was family allowance. And, that helped to defray some of those taxes that we were paying in for the purposes of everything, but including healthcare. And I'm just wondering about the timing. Was there a family allowance in place during any of these stages of trying to get universal healthcare in Saskatchewan?
Well, Saskatchewan had implemented various programs before 1947. But they were more like means tested programs, in other words, or demographic sectors. They had implemented, a pension program for retired people. They had a program for various diseases like tuberculosis, which were basically universal care for TB treatment. And they had trying to think of widowers and people who had lost the sort of breadwinner in the family. They had programs to help those situations. I don't know about a family allowance specifically, but there were a lot of incremental steps leading up to universal hospital care. And
the family allowance was sort of like a tax credit, type of model there. That was federal. And the other thing we knew about there was that there were significant differences from province to province in terms of the details of all of these. So I think it's a good model if we're doing something, state by state. It's really not a bad model to be able to fall back on. Thank you.
Yeah.
Okay, Mark, I think you still have your hand up. That's not a new question, I assume.
Oh yeah, sorry.
Jack, that's okay. Jack, you want to say something?
Yeah, hi. Just a couple of thoughts. Also, with collecting signatures, how eager people are to sign on to this. This is an unusually opportune moment to be pursuing this because of all of the historic rises in premium costs that everyone is feeling right now. And I think the getting into the weeds and the minutia of funding is unnecessary for us as citizens. Again, we're pushing the legislator to act, the committee to act, to get this out of committee, and we will then be part of that commission that decides on how to finance. But if we understand that we're talking about a basic premise, we're not talking about every little detail in the weeds of this, and every place where this is tried, it has been successful. So if the basic premise is everybody in, nobody out, care for all, that then we trust our legislators with appropriate pressure from citizens to figure out the financing, which I'm sure we're all sure will be infinitely better than what we're experiencing now.
Okay, I'm going to, because we only have 2.5 minutes left, I want to very quickly address a couple of questions that have come up about the legalities of this. This is the Vermont petition law that I'm showing on the screen right now, which says we can do this. And what it says is you need 5% of the voters of the municipality. And if you can file a petition with a proposed resolution at least 47 days before the day of the town meeting, they must put this on the warning. The select board must. This is not something they have a choice about. There was a question that came up about that before the session today. We had a couple of pre-webinar questions. I just addressed the first one of those. Can the committee make changes to the bill? And we've talked about that, so absolutely. And I think we've covered all the questions, at least that we have time for in this session. There will be a recording. I will try to get it out no later than tomorrow morning. There's some editing that I'll have to do, to get that ready. And everybody who registered for the webinar will get a copy of the recording, and it will be available for anybody else. So if you know other people who want to see or listen to what we've talked about, you can share the recording with them as well. So the next steps on this is getting the petitions signed and submitted no later than 47 days before the town meeting day. In most towns, that's March 3. And in some, it may be on the preceding Saturday. And if it is, then you have to get the petitions in by January 12th. And you just take them to the town clerk's office, hand them in, and you should try to get at least 1% or maybe a 0.5% more signatures than actually needed, because some of them may be invalid. That's typically what happens. And then it gets on the ballot. But if it, for some reason, doesn't get on the ballot or doesn't get warned, doesn't get added to the agenda, you can go to the town meeting, show up at the town meeting, and preferably with a group of other people. And in the open question section of the meeting, you can raise this issue, and there won't be an official vote on it, but you can get other people energized about what this is. But as Ellen pointed out in an email earlier today, I believe, we should not wait until March 3 to have major public fuss about this. We should be doing whatever we can to raise awareness about the bill and that it's stuck in the committee. And what we're doing is a citizen's form of voting it out, of requiring that it be taken up, which we've seen in the federal Congress recently with a couple of actions where they have signed what's called a discharge petition. We're effectively, as citizens, trying to require the discharge of this bill from the committee so that it gets voted on in the full House and Senate. Any final remarks or questions before we close the webinar? If not, thank you so much for joining us and for your participation.
One minute.
Yeah.
I'm going to post in the chat the toolkit, which has a link to the petitions and other things, because some people have asked how they get the petition. So I just posted in the chat the link to the Google Drive where you can get generic copies of the petition that you can then write in your town's name. And that link also has other things like a video and an FAQ about universal primary care. So it has a bunch of different things. So if you visit that link, you can get information as well as copies of the petition and other things.
Thanks, Ellen. I will also make sure that in the follow-up email with the recording, we include a link to that resource. And within the next day or so, the website should be ready, and we'll let you know about that as well. If there's nothing further, I'm going to say thank you again for your participation, and good luck with the effort, and everybody have a great evening.
Thank you.
Bye.
Thank you.